All right, so I am very excited to chat with today's guest, Dr. Kirk Gair, as we are going to be chatting about laser therapy and, of course, relating it to thyroid health. And so let me go ahead and talk about Dr. Gair's background. He is an international laser expert who has been using lasers for 19 years and teaching laser therapy to doctors since 2017. And his research recently led to the first FDA clearance for a green and violet laser for chronic neck and shoulder pain. And he has been trained in functional medicine and neurology by his longtime friend, Dr. Datis Karazian, and has been featured in Dr. Isabella Wentz's The Thyroid Pharmacist documentary, The Thyroid Secret, and her New York Times best-selling book, Thyroid Protocol. And thank you for joining us, Dr. Gair.
Thank you, Dr. Osansky. It's great to be here. I'm happy to share this information with people because I know a lot of people don't know about what lasers can do to help them. So it's great to kind of spread this out there. As you said, I've been using them for 19 years, and it's just now popping into people's consciousness now. So it's kind of cool to see this awareness happening.
Yeah, I'm a big fan of lasers. And as we were chatting before, I pressed record. I haven't used a laser as far as when it comes, especially when it comes to the thyroid. But so I'm sure a lot of people are tuning in and they're just wondering how can laser therapy benefit thyroid? So, yeah, very excited to
Yeah,
talk to you about that and dive into the research because there actually is research behind that as well, which I know you'll
absolutely.
get into a little bit. But
Yeah.
yeah, so if you could expand a little bit on your background, like how did you actually get into lasers?
Oh, sure. Well, I graduated in 1999 with Dr. Karazian. We were classmates, and he was so far ahead of his time. He already was doing functional medicine. He did functional medicine workup on me in school in 1996. Which is great stuff. So we had a group that we were all kind of looking towards the future of things. And so about 5 years after I graduated, what I noticed was that as my skills were getting better, it seemed like patients were taking longer to get better, like they needed more interventions, more things to be done. So I started looking at what was working to get, say, top tier athletes back onto their game as quickly as possible. And I found this doctor, Dr. Jeff Spencer, who was working with at the time the top athlete in the world, Lance Armstrong. And Lance did whatever he could to win, both legal and illegal. And Dr. Spencer was part of the legal side of it, where he was using these zirconia lasers on Lance every day before he would participate in the Tour de France. And Lance said they helped to enhance his performance, helped him to recover quicker. And so that's what got me interested in it first, was to work with athletes to enhance sports performance, get them to recover from concussions, to recover from injuries faster. And so that's what I was doing at first, starting in 2004. And then things really took a change with a couple of things happening to family members. The first thing was with my cat, Poopsie, in 2008. We came home from a great evening out. We live in Southern California wine country in Temecula. We went to the local Indian casino called Pachanga, and we had a great night out. And we come back home and we find Poopsie on the floor, unresponsive. And I don't know about you if you have pets, but my pets always manage to get sick not during vet business hours, but the after hours where you have to go to the emergency vet. And so that's what it was. With a Saturday night, like 1 in the morning, and Poopsie's unresponsive. We pick him up, we rush him to the emergency vet. They check him out, and they tell us that he has acute necrotizing pancreatitis. They said basically his immune system started an autoimmune attack, just like Hashimoto's. Or Graves, autoimmune attack on the pancreas, and started destroying the tissue. And they said, we don't have a treatment for this. He has destroyed 90% of his pancreas. He's 11 years old. We recommend you put him to sleep. And Poopsie was like our fur baby. Like, he helped my wife and I get through the stress of me going through chiropractic school and she getting her master's in clinical psychology. And so I wasn't willing to give up. And I said, hey, listen, I want to take my cat home and I'm going to use my lasers on him. At the time, I was using this violet and red laser. And I said, I want to take him home. I'm going to use the laser on his pancreas and see what I can do. The vet rolled his eyes at me and said, you're not going to be able to do anything with the lasers. You've got to put him to sleep. And so I told him, well, what do I have to lose? Let me just take him home and try. So he said, all right, look. He said, today's Sunday. By Wednesday, he'll probably be yowling and in a lot of pain. And you're going to need to do the humane thing at that point and bring him back in and have him put to sleep. So I said, all right, fair enough. So what I did is I took him home and I started using the laser, and I just placed it over his little kitty pancreas, right here in the abdomen. And I did that twice a day for about 5 minutes at a time. And by Wednesday, instead of yelling and being in a lot of pain, Poopsie was doing really well. He was up, he was more energetic, he was eating, and each day he got better. So Saturday, I take him back to the vet, I set him down, and the vet says, wow, your cat looks surprisingly good, but don't get your hopes up. He's probably going to be worse. We're going to do another ultrasound of his pancreas. He had 90% destruction. If it's worse, you got to put him to sleep because this autoimmune attack on the pancreas is just destroying things, and we don't have a treatment for it. So I said, all right, fair enough. He takes Poopsie back, does the ultrasound, and he's scratching his head. He calls over another vet. They're both looking at the ultrasound. They're both scratching their head. They call me back in the back of the office, and they asked me, what the hell did you do? And I said, why, what's wrong? And they said, no, nothing's wrong, but we've never seen this before. Here's his pancreas last week was 90% destruction. Here it is this week. We had to make sure we had the right film to make sure it was the same cat. I said, you just regenerated 80% of his pancreas in a week. He now has a 90% normal pancreas, which he said for an 11-year-old cat, that is normal for that age. So what the hell did you do? So I told him I use lasers. So the interesting thing about veterinarians is they jump on technology. They're not slow to adopt like human doctors are. But the vets, they jumped into it and they started doing all the treatments with lasers there. But he said, listen, I've never seen this before. You just halted this pancreatitis that's necrotizing and regenerate the pancreas. And so this sparked my curiosity here of how does this happen? And it got even better in that they said Poopsie was going to be diabetic from then on, and that the insulin would only work for 1 or 2 years, and then it wouldn't work anymore, and he'd need to be put to sleep, and he was going to need 4 units twice a day. Well, I kept doing the laser of his pancreas, and he got better with that too, to where he needed, instead of 4 units twice a day, it was 3 units, then 2 units, then 1, then 3/4 of a unit, eventually 3/4 of a unit every other day. And he lived not just 1 or 2 years, he lived 6 more years. And the vet was always amazed. He says, I never see a cat get better from pancreatitis or improve with their diabetes as well, because his diabetes was an autoimmune one. And so that's when the light bulb started to go off for him, saying, hey, what's going on here? And I started looking at the research, and the Russians were already doing this back in the 60s and 70s. They were so far ahead of us. So that was really what kicked me off with the lasers, was what happened with Poopsie. Then the secondary thing that happened was when my wife got really sick, when she was given an iodine contrast with some imaging, and that created a whole thyroid storm. And she almost died from it. She was bedridden. No one could help at all. She was seeing doctors at Harbor UCLA and Loma Linda, just as the thyroid was going crazy. And it was going to see Dr. Karazian. I went to Dr. Karazian. He did a long exam on her, and he said, yeah, here's what you have. The massive amount of iodine contrast. She would have had an underlying, Hashimoto's hypothyroid antibodies, and the iodine kicked it off. And now he said it started an attack against not only the thyroid to dump thyroid hormone, but also against the cerebellum, and then that affects all the autonomic nervous system pathways. And so as he's talking to me about this and telling me about how these things, like especially once it starts the attack on the brain, how it gets really ramped up, you got to calm it down. The light bulb went off as I was thinking about Poopsie, and I said, hey man, what do you think about me using the lasers? This was 2011, lasers on her brain and maybe on her thyroid. He said, I don't know. Let me do some research and take a look. And he's also got a PhD in clinical research from Harvard. And so that night he gets back to me, and he sends me these studies on lasers and the brain in neurodegeneration and autoimmunity. And he actually says, dude, laser the crap out of her brain. He said, I didn't even realize this was out here, but it was showing how the lasers could actually reverse neurodegeneration and affect autoimmune kind of pathways within the brain. And that's where everything really kicked off, was necessity being the mother of invention here. And then I took the deep dive into the research 12 years ago, and it hasn't stopped since then.
Wow, those are some pretty cool stories. Amazing with your cat Poopsie, and then it sounds like so your wife was your first thyroid patient, the first person that used cold laser when it as far as the thyroid goes, and the brain.
Correct. Yeah, and we went from her being bedridden to a year later we were playing tennis together, and Dr. Karazian said, he's like, he said, you don't really see that with just nutrition and supplements alone. He said to have that huge of a change with the coordination of the brain and these different neurological pathways.
Now, so with your cat, it sounds like I think you said that you pretty much use laser every single day. Not,
I did
for until she passed away, correct?
So yeah, I used them initially on him for that first week. It was every day, twice a day. And then ongoing, when he was first acutely diabetic, I used it on about a daily or every other day kind of a basis. And then ongoing, it was just like once a week or a few times a month that we used for the next 6 years. It wasn't a daily thing, but it was initially more intense. So a lot of times what we do with my human patients is we do laser rentals in the office to where the patient can rent one of these handheld devices when they're in a really acute crisis and take it home, and they can laser the guts, the thyroid, the brain, these different pathways to work on it in at home a few times a day to try to really kind of stabilize the condition. And then for maintenance things, they can do things on a less frequent type of a basis. And patients
Okay.
can even buy these to use at home too for themselves.
Yeah, that's where I was getting at. So I wasn't sure if your wife is still using it like on her thyroid, for example, like every single day, but it sounds like she's not. If anything, maybe doing it maybe like once a month or a few times a
She's
month.
probably more frequently than that. She likes to do it a couple times a week, 2 or 3 times a week is what she likes to do. We definitely, when we travel, we'll take it with us when we travel because it fits in a purse, fits in luggage, and that way, if when you're out, because with autoimmunity, with stress of travel, it can ramp you up, and then you might get exposed to different foods or different kinds of things, and so that you can use this to kind of dampen the inflammation and calm things down, and so it's really handy with that.
Yeah, can you talk a little bit about the research? Because again, there is research behind
Sure.
this. It's not just like you
Yes.
you
Yeah.
had this experience with your
No.
wife, but
Yeah. Yeah. Yeah, no, so the research, so like I said, after these two things with family members, I did a deep dive, and patients can look it up themselves too. If they go into PubMed, they can search the research there, and they can see that the Russians, by 1974 in the former USSR, low-level laser was used as state-sponsored standard medical care. And they used it for everything, not only for autoimmune things, for neurology, even for oncology, for cancer types of patients, things that we still see as off limits here in the US. So they've been doing that, and then there's a study that Isabella Wentz and I discussed a lot, which is called the Hoffling study out of Brazil, and that was a big one because Hoffling and his colleagues, they took patients and followed up with them for 6 years, and in it they were lasering with low-level non-thermal lasers. This is a key thing. So when people listening to this, this does not include high-powered class 4 lasers that are thermal. You don't want to use those over the thyroid. Those thermal types of lasers, you can't use them on these heat sensitive tissues here. And really, even though some doctors try to use on the brain, there's research that shows that could be, if it's very high powered doing a high dose, that could be problematic from using that for brain fog. So Hoffling was using these low powered, low level lasers, and in the groups that he followed, he showed that 47% of the people in the study didn't need any additional medication at all, that they were able to go off of their thyroid meds. All of the patients in the study showed a decrease in the TPO antibodies. We know that's really significant because that's how you can set up the thyroid for destruction. And then these cross-react with the cerebellum, causing destruction as well too. Similar to my cat Poopsie, he showed in the study that when they did ultrasound of the thyroid, that the thyroid gland appeared healthier, and the blood flow with the thyroid gland was also healthier as well. So that was one of the big research studies specific to the thyroid. When we look at autoimmunity in general with low-powered lasers, non-thermal lasers especially, is that they can provide support to autoimmune conditions. Because let's say when I take, say, like this laser here, and I'm putting on the body, either on the brain or here, and this is a green laser and a violet laser. This one is a red, this one's a red and violet laser. And as you can see, oh, there we go, over here, it's hard to see the violet because it's so well absorbed by the body. But anyway, as we get that on there, it's going to trigger you to make some things that are beneficial for autoimmune patients. Like you're going to make glutathione. You're also going to make nitric oxide. And you're also going to modulate cytokines. So you're going to stimulate the production of interleukin 10, which helps to regulate inflammatory cytokines. And it's going to help to downregulate inflammatory ones like interleukin 6. You're also going to stimulate stem cell production. And favorably modulate inflammation and immune markers in the body as well too. And it's really cool when we look at what we're doing on a cellular level to support the body. And with the violet lasers, it also provides immune support against microorganisms, against viruses, bacteria, etc. We know a lot of patients with autoimmunity have chronic infections, so the violet wavelength particularly helps support the immune system against those. There's also research showing that the laser can help, even though it doesn't directly penetrate to the gut, it can help to repair a leaky gut barrier, a leaky brain barrier and also help to support the microbiome as well. So it starts to sound like snake oil when you start to say all these things, but there are actual research studies on all of this that supports what the laser does, and for all these different types of conditions, because it's not just say specific to Hashimoto's or to MS or to Graves. We're looking at it supporting all those pathways that are involved with immunomodulation and immunoregulation. And a key thing here, when we get the laser on the body, it supports your T regulatory cells, which helps to down regulate autoimmunity as well too. So when you've got those T reg cells that are being supported, you can help to kind of tame the fires of an autoimmune reaction.
So one of the questions I was going to ask you and still will ask you is the potential benefits for hyperthyroidism, including Graves, because with Hashimoto's, you get the damage to the thyroid gland, so that could help potentially regenerate the thyroid tissue. But with Graves, it's a little bit different. But from what you just said, that it's also modulating the immune system, helping with the regulatory T cells. So it sounds like it could, in fact, help with people with Graves as well as other autoimmune conditions. You mentioned, I believe, MS as well.
MS, we're seeing that with MS patients with, obviously, first thing I have to say is that no laser is FDA cleared to treat those conditions. So this is being used just like you would nutrition and supplementation. These are supplementary types of things. And when you look at, because if you're looking at any kind of an autoimmune condition, what do we do, whether it's Graves or Hashimoto's or MS or rheumatoid arthritis? You try to remove the offending foods, the offending triggers from the environment. You work on supporting anti-inflammation, etc. And that's how laser works in supporting these different pathways. And so when we get the laser on the body, it even helps with Th1, Th2, and Th3 balance. And because the body's going to absorb the energy from the laser and use it as it needs it. So that's one of the cool things. When you get a laser on a sick cell, it's going to respond to the laser differently than a healthy cell. So the cells have that kind of innate wisdom in a sense of saying, hey, this energy is coming in. This is how we're going to use this. And a key thing I want to point out here is that, when we look at any of these autoimmunities, whether it's Graves or Hashimoto's or anything, we know that there's commonly problems with mitochondrial dysfunction. That's a really common dysfunction that's going on there. And when we look at these, so when I have these lasers here that are red, violet, and green, these actually support the entire mitochondrial respiratory chain, the electron transport chain. They support all the phases of it. So you might have with an autoimmunity, a patient has a problem at complex 4 or a complex 3 or 2 or 1. And historically, red lasers and infrared lasers will only impact complex 4 for making the end product of ATP, which is the energy the patient needs. But complex 3 is affected by green lasers, and complex 1 and 2 is by violet lasers. And so that's why on the autoimmune patients, and all my patients really, I use all of those wavelengths, those 3 wavelengths. So we're getting the entire support for the electron transport chain, which is generating the energy needed for everything in the body. So that's where you can still help the patient with Graves or those other conditions too.
Yeah, you're answering questions before I asked them, because another question I had was, as far as, which I know the answer, are all lasers created the same? So because someone could just go on Amazon or online somewhere else and just purchase their own laser, but you're just mentioning right now that there's different types of lasers, the violet, the green, the red, and they have different types of effects, it sounds like.
They do. And so you'll have some people who will say that, oh, well, and let's start, for example. Well, an LED is just as effective as a laser. They'll go out and they'll say that. And they'll even try to, there's one study by Hamlin that tried to say that LED and lasers were shown to be the same. Well, in head-to-head research, it's not shown that way. So Erconia, the company that I use, they have the most FDA clearances of any laser that's out there. We do rigorous level 1 testing. And when we do our studies, we compare them head to head with LED devices that have the identical wavelength and identical power and identical parameters. And when we compare them head to head, an LED device, I think they're great for patients to use at home. But you get roughly about a 10 to 17% effectiveness compared to a laser when you do a head-to-head study. In the studies that are out there where they try to say that LEDs are just as effective as a laser, many times they're poorly designed studies where they will use a laser of one particular wavelength that's not as effective, or of a power of a dosage that's not as effective, versus an LED that's of a more effective setting. So they might compare, like, let's say, a red versus an infrared, and they do the settings, they kind of set it up for failure in a sense. And sometimes they'll use ones that specifically just don't work at all. So those ones, I think they're good for use at home, not so great to use in the clinic. Problem is, right now you'll see a lot of these devices are coming in from China that are very cheaply made. Some of the LED bulbs cost as little as 6 cents a bulb on there, so you're not getting the same kind of effect that you do with a laser. When it comes to different wavelengths of lasers, the easiest way for people to understand the difference in whether it's violet, green, red, or infrared is, let's say that let's give the example of, let's put a person in an ultraviolet tanning bed and put someone under an infrared heat lamp, and see what's the difference. In the tanning bed, that particular wavelength of ultraviolet light is going to trigger things like melanin production for a suntan. You're also going to stimulate vitamin D production. That's not going to just be in the skin, but it's going to go throughout the whole body to strengthen the bones, support the immune system, etc. When you're under an infrared bed, you're not going to get those impacts, but you're going to get impacts like for thermal heating, relief of pain, improved blood flow. So we get different kind of effects with different types of wavelengths of devices that are on there, and they each have their different uses. When we have, like, say, an infrared type of a device, they are lower energy devices that work through mechanical activity on the tissue by causing vibrations and oscillations, and also a thermal impact. So that's where, let's say, when we're doing things on the brain or on the thyroid, you have to be careful with how powerful they are in watts, because some people think that more power is better, but as we know with autoimmunity, you have to be very careful with how much you load a person up, whether that's exercise or a dose of a supplement or whatever. And you have to do the same thing with the energy coming in with a laser. When you ramp up the power, it can overload an autoimmune patient. So in the visible wavelength, we do have higher energy per photon in there, but we use lower power on there, so there's not a thermal impact, and that way the dose comes in slower. So this way we can not overstimulate an autoimmune patient in a better manner, and that's particularly important for the brain, because if a patient looks and they're getting a very high wattage type of laser on the brain, in a matter of a few seconds, it can potentially overstimulate an autoimmune patient or someone who's been concussed, and then that can flare them up. With the lower powered lasers and the lower wattage, we have a longer time, so we can start to see how the patient is responding to it. And if they start to feel like they're getting overstimulated, it's easier to stop before you pass what's called the hormetic threshold.
Okay, so it sounds like more is not better, and then if someone just goes out and you're not saying anything bad about red light therapy, but if someone has their own
No,
red light
it's
therapy
critical.
unit, it's just not going to have the same impact as a cold
Yeah.
laser, kind of like the one that you have from Marconia.
It's not, it's going to be different. Again, you're going to have a lot of people, a lot of well-known influencers online who are going to say, oh, that's completely wrong. But again, I challenge anyone to go and look at the studies. Don't listen to me, don't listen to the influencer, don't listen to the salesperson. Go and read the actual studies, look at it. Was it head to head? Did they use the same parameters or not? Because I got into a discussion with a doctor on this the other day, and he was saying, oh, well, anybody knows that you've got to ramp up the power way higher on it with LEDs to get the same effect as a laser. And so I said, that tells you they're not equal. They are different, because if you ramp up power, you now can also have more of a thermal impact, and that can also have some problems as well too. And again, the head studies, they're just not showing quite as much. I'll give you a big example. So we did a study on autistic kids in Cuba, and we used a true laser that we did transcranially, and we used an LED device of identical parameters. Laser had fantastic results. The LEDs showed no changes in behavior, no changes in mood. And then on the functional MRIs, the laser showed that it changed blood flow and neuronal activity to the frontal lobe and to the cerebellum, whereas the LED showed no changes. We then took those kids who were in the LED group and crossed them over, and they became their own control, and they received the laser, and they got the same benefits, the same changes on the functional MRI, and the same changes in behavior that they didn't get with the LED. So those are the kind of studies we're talking about when I'm saying there is a difference. I can cite specific research showing the differences with these in head-to-head studies. But again, good for use at home. But just in the clinic, I like to use the better device. It's like, if I'm going to race in the Indianapolis 500, I'm not going to bring my old V6 Mustang, which I love that car. It was a sports car technically, but if I try to race in a race against actual sports cars on it, there's going to be a difference. There's going to be a difference in the effectiveness of the two things.
Now, after someone goes in for treatment with the laser, and then if they want to do wellness treatments at home and get their own laser, is there still a difference between like the portable lasers and like red light therapy, the LED?
Yeah, there's still, so like when we look at these handheld devices that I have here, when we got the FDA clearances for these devices for chronic neck and shoulder pain, chronic low back pain, chronic foot and heel pain, post-operative and preoperative supports, body contouring, etc. These have the same effectiveness. These, I actually use these in my office. So these are the devices that I use. These will still outperform a red light therapy device or an LED therapy device. So patients can use these at home. That's what we do with it. When I have a patient who, in their family, there's a lot of autoimmune patients, neurodegenerative patients. I actually encourage them, buy your own device. That way you guys can use it all on each other at home, because this is something you're going to need for life. And the more frequently you can use it, the better it's going to be. These are safe for use at home. We don't have to, these are what are called class 2 lasers. So they're the safest ones that are out there. They're not going to damage the eyes if you flash it. They're not going to damage the thyroid or the brain, because they don't have that high power to them. So patients can use these and have the same kind of effectiveness in their home that they would in the clinic. The difference is when I'm in the clinic, I'm also doing some different brain-based therapies, depending on, because Hashimoto's, we see brain fog, we see different kinds of issues neurologically that tend to go with it. Graves, you'll see the same kind of things can happen. Any of the autoimmunities, we tend to see brain involvement. So I'll stack some brain therapies on there. We usually do some gut support, some adrenal support as well.
And when it comes to the actual procedure, are you actually taking the laser and like putting it directly on the thyroid?
Yeah, so this is what it would look like when I have it in the office. We can go right across here, because again, this is a non-thermal device, so we can safely do this. When it's a thermal device, that's where you have the manufacturers even say it's contraindicated there, because these are heat sensitive tissues. We'll go on there for a few minutes on it, and that's going to help to stimulate stem cell production. That's going to stimulate nitric oxide and glutathione, which Dr. Karajian says helps to kind of take the bullet in the autoimmune attack, that helps to kind of tame it, modulate Th1, Th2, and Th3. And we're going to help to stimulate the production of ATP. And I like to use all 3 wavelengths together, the green, the violet, and the red, because we get this synergistic effect, each wavelength doing some different kinds of stimulation on there, because there are wavelength specific reactions in the body. And what I'll do with the Hashimoto's patients is I'll get it up here on the brain as well. And let's say if I got a Hashimoto's or Graves patient who's having things with dysautonomia, we can laser the brainstem and then do vagal nerve exercise at the same time, like gargling, gagging, or use a little vagus nerve stimulating device near the ear. And so we get that vagus nerve activation while we've got the laser going on at the same time. So we activate those neural networks. That helps to drive the laser energy to those particular regions that are also involved with it, and help to repair those neural networks, and actually create some new neurogenesis, so new nerve tissue and new synapses, and that helps with the overall functioning of the patient.
Here's a question you might not be able to answer, or maybe you can, but a lot of patients with Graves' disease have, I don't know if you're familiar with thyroid eye disease, which is more of an
Yes,
immune system condition. So, yeah, so
correct.
from an immune system standpoint, it sounds like it could help, but also they do have a number of people have cosmetic changes like proptosis, bulging of the eyes. And you mentioned that
Mm-hmm.
at least the home laser is safe for the eyes, but I guess as far as treating the actual eyes, is that an option, or is that something you would say don't do on your own, or even you, like if someone went to you to see you in person, is that something you'd feel comfortable doing? Even though I know it's not FDA
Yeah,
clear for that, but
no,
do you have any experience, I guess, with like eye conditions or?
we actually do. It's funny. One of my patients has Graves, and he came in with what his endocrinologist said was like the thyroid eye conditions related to it. He was having some different issues there with also irritation and some blurry vision and all these different things. And so what we do with him is, as he was getting issues with focusing, and with the blurry eyes, is we put the laser first on the brainstem, and then we did eye exercises. So we did cardinal fields of gaze stimulation. So he's activating those neural networks and having him focus on a finger coming close in here. And so as we're activating those neural networks and getting a laser on them, that's actually improving their focus on there. And then what we did on him is we just have him close his eyes and just do the laser right along here. And this is completely safe to do. It's even, the FDA even considers, like, let's say if I'm flashing like this, that's even considered safe, because the blink reflex with a visible laser will protect the eye. But also, as you see how the beam diverges there, how it's spread out, that spreads the energy out over a larger area. So it's not focused enough to create damage. Let's say like if you're doing a laser pointer that's pin light and all of the energy is focused in one spot where that could be damaging. As this is spread out here, we can do these wisping kind of techniques. What I do is I have them close the eyes and we do the laser like this, and then the energy gets spread out over the eyelids, but still will trickle down to the eye and help to damage the inflammation. We had patients with other autoimmune conditions, even chromosomal types of conditions that we've done this on, who were losing their vision, and we co-managed them with their ophthalmologist and their optometrist. And it's been really wonderful where I had these patients who were getting even steroid injections in their eye once a month. Then when we started doing the laser, like on a weekly basis, they didn't need the steroid injections anymore. And again, the ophthalmologist was completely supportive of what we were doing. In the case with my patient with Graves, the endocrinologist was supportive of what we were doing, and we saw improvements with the eye condition that he had related to Graves. So yes, we have seen that. It's in the research. The crazy Russians, they've been doing this stuff since the 1970s, and they're like, why doesn't Europe and the US do these things? But they said one of the problems in Europe and the US is we tend to think like Tim the Toolman Taylor, that more power, this baby needs more power, ha ha ha. And they said that when you ramp those things up, then like you can't really do that here on the eyes and with the thyroid. And they said when you do that, it changes the way that the laser works and kind of can limit some of the conditions you can treat. It can be great for musculoskeletal conditions, but for some of these other more sensitive ones, it doesn't quite work as well.
How about thyroid nodules and like larger goiters? Have you seen success with those?
Yeah, so it's an interesting thing. I had actually one patient scared the crap out of me. She came in. She was one of these patients. I get a lot of patients who come in who are not fans of chiropractic. They don't like the adjustments, but they're coming in because they use a laser. And so she came in. She said, "I don't want you to adjust me. I don't like being cracked, but I heard great things about your laser for neck pain, so I want to do this." So I have this device called the FX635 that has 3 lasers that rotate and scan. And so we're using this on her neck. We got great results. She works as a court translator, so she's always looking down and typing and a lot of work like that, a lot of neck pain. And so we've been doing this on her for like once a week for 6 months. And she's got great results. And 6 months later, she tells me, "Oh, by the way, I didn't tell you that I have thyroid cancer. And I was scheduled for a complete thyroidectomy." And I'm like, "Oh, God, great." Because it's like I was using the laser literally right around her thyroid. I asked her if she had any issues, and she said no. And I said, "Well, why didn't you tell me about this?" She said, "Oh, I didn't think you needed to know because it's not in your, in your scope or in your specialty." And I was handling with my endocrinologist and my oncologist, so I didn't think it was a big deal. So I said, "All right, so what's going on?" She said, "Well," I have to tell you. She said, 6 months ago before I started, the cancerous nodule was 2.5 centimeters in size, and I was scheduled to have it taken out next month." And I said, "Okay, so what's going on now?" And I'm thinking, great, like, is she telling me it's worse? Is it spread or whatever? She says, "No." She said, 6 months later, it has shrunk to 7 millimeters. So she had a 74% reduction in the size of a cancerous nodule in that time. And she said, "I know it's a laser." She said, "This thing has been there. It's been slowly growing for years." She said, "Now I add in a laser and it shrinks." She said, "My oncologist was shocked. He said he had never seen a change like that where it reversed, but," she said, "he's now canceled my surgery and he's just going to monitor it at this point." So, I saw that, and I'm not saying go out and treat cancer with lasers, a caveat on there, but this is what we saw with this patient with like the worst kind of nodule you can think about, that we saw this improvement. So I got curious again about the research, and so I started looking at it. And again, the Russians by the 1970s were doing things with lasers with cancer. Now here in the US, we still consider it taboo. You don't want to do that, because if you take cancer cells and put them in a petri dish and you laser them, they grow like crazy. But if they put them in a petri dish and put immune cells around them, there's a lot of studies out of Kyoto, Japan showing this, is that the immune cells will surround the cancer cells and kill them, and will actually, destroy the cancer cells. So one of the things the Russians were saying is that you support the immune system and it helps it to fight off the cancer cells. And so I actually have some patients who've come in who are undergoing chemo, and we'll use it on another area of the body, because these lasers have what's called an abscopal effect or a global effect, where if I laser a person's legs, they're going to get a global benefit of increased energy, immune support, stem cell production, etc. So we've seen that with these cases like this. We've seen this with other patients with benign nodules as well too. I haven't seen any studies on nodules and the thyroid, but these are the small ones that I've had in my office, which is pretty darn cool.
Yeah, that is cool. So, I mean, From what I understand, cold laser can potentially regenerate thyroid tissue. It can help modulate the immune system. It can help
Correct.
with thyroid nodules, thyroid eye disease. Again, everybody's different, so you're not claiming that every single person could be helped, but still, a lot
Right.
of people will just take, as you know, with Hashimoto's, for example, they'll just be on thyroid hormone for the rest of their life and
That's
not
it.
do anything
No
to try
dietary
to address
changes,
the.
nothing at all. Yeah. Hmm.
Exactly, and same thing with these other health conditions, they'll just follow the recommendations of their doctor, so it's great to hear that there are other options, and yeah, it is important, like you said earlier, it's not just about the cold laser, but you also recommend dietary changes, stress management, doing things to find
Stress is huge.
remove triggers, correct underlying imbalances.
Yeah, and stress. I mean, that's an important one too, because I know Dr. Karazian, when he teaches us in our functional medicine courses in functional neurology, he says stress is a deal breaker for autoimmunity. He used the example of he had this patient who was, I believe, he was a Hashimoto's patient, and he was a Wall Street broker, and he said this guy, he did everything perfect, like he ate a perfect diet, he removed all the offending materials in his house, like took the carpet out, put in tile, changed everything, all the furniture. But he still was a mess because of the stress of being on Wall Street. And so Dr. Karazian said, listen, man, nothing's going to change unless you deal with your stress. So the guy actually quit his job as a Wall Street broker, moved to Mexico and tends bar at a resort. And everything went into remission, because he dealt with his stress. Like it completely changed things. So not saying everybody has the ability to leave a job and go tend bar in Mexico, but another cool thing about the lasers is the lasers actually help with stress management too, because especially we can put these on a setting of specific pulse frequencies. I use these delta frequencies that are just 1 hertz per second, and this has a calming impact on the brain. So we'll have patients coming in who might be ramped up from Graves or Hashimoto's too, when they get into that hyper phase and they have that anxiety and they're going through that storm. We'll put on these delta settings, and then we'll use like a vagus nerve stimulator, like I use the Hoolist Mini on here, and have them do some breathing exercises, and this can actually have a big calming impact on them to tame the brain, calm down the nervous system, and help them to manage their stress levels better. We'll do that sometimes, or we'll stack the laser with the Muse headband. I don't know if you're familiar with the Muse headband at all, but it does EEG scanning here, and it's a couple $100. Patients can buy it on their own, and it interfaces with an app on their phone, and it'll give them biofeedback of what their frontal lobe is doing, if they're controlling their brain waves. If they're controlling it, it'll sound nice and calm, and they'll hear birds coming out. If it's all scattered and all over the place, they'll hear wind and rain and loud sounds on there. So we'll stack the laser with like the Muse headband or the vagus nerve exercises, so we can help the autoimmune patients with dealing with their stress.
Wow, that is pretty cool.
Mhm.
All right, awesome. Uh, Anything, I know we spoke a lot about lasers, which of course that was the purpose of this chat, but is there anything I should have asked you, Kirk, about lasers that I should have asked you that I didn't ask you that you'd like to chat about?
Well, yeah, I think a big component on here too is that sometimes patients will, as they have an autoimmunity, is they think that, oh well, things are just going to get worse, or at best I can kind of maintain here. And when we look at what lasers can do, is lasers can really, according to the research, they can really help to enhance a person's even performance. Let's say if they're already starting to do well, you can improve their overall performance, because let's say, like, as I have this patient coming in, with Hashimoto's or Graves or whatever, and their brain's not functioning very well. As we get a laser, like here, as I have this on the brain, we're going to stimulate things that can actually enhance them to function better than they did in the past. So we see with some of these autoimmune patients, they'll have things like motion sickness is one of the most common things that I see with patients, to where they're like, they have a history of being ticklish from the time they were a kid, or they can't watch an IMAX movie or something like that. We'll actually get the laser on the brain and then do balance exercises with them, or eye exercises, and we see some of these old symptoms disappear, and that's part of the brain rewiring itself, and improving longevity too, because we get the lasers here, and we're going to stimulate those stem cells to make new healthy tissue. We're going to stimulate brain-derived neurotrophic factor, which I call that like miracle grow for brain cells. So you can make actually new neurons and new synapses with that. And then you're also going to stimulate things like lymphatic drainage to drain off of like inflammation off the brain, if we pulse the laser at 40 hertz. And again, the reason why I mention this because as you know, and your listeners may not know, once there's one autoimmunity, many times others pop up as well too. And then there's a lot of autoimmunity in the brain. We're looking at potentially like, Alzheimer's and other forms of dementia having autoimmune components and being related to even like a diabetes type 3 as well. Let's say even if you have a patient who has those things going on where they now have autoimmune reactions to the brain, we can tame those things in the brain. If they have like these protein misfoldings occurring in the brain that are common in Alzheimer's, dementia, or even Parkinson's, 40 hertz has been shown to be able to stimulate these resonant waves in the brain to actually break apart the protein misfoldings that are occurring in there. So this current research is showing you can actually not just help prevent further neurodegeneration, but you can actually reverse it if you catch these things early enough. And so that's the key things for patients to pay attention to. Like what's going on with them? What are all their host of symptoms that are happening? Because you can reverse a lot of these things when you're combining the diets, meditation, stress management, and you add these lasers in there as well too. Let's say if you got a patient with autoimmune rheumatoid arthritis, where they're just on immunosuppressive drugs, and they're saying, oh well, your joints are going to actually just degenerate over time. The lasers on there, you can stimulate regeneration of the joints, new bone formation, new cartilage formation. So that's the exciting thing about that, is that these are really the wave of the future. I see this as being like, this is the Star Trek of the future, whereas most of the medical model is 20th century. We're looking into the future of how you're using these different wavelengths of light and frequencies to actually signal the body to repair and to direct what's going on there. And that's where the current research is. We talked about things that were just released on PubMed, talking about using targeted photons to stimulate your body to communicate via biophotons to make these changes, which is really exciting stuff.
Yeah, that does sound really cool. And you're right about people with one autoimmune condition more likely to develop other autoimmune conditions in the future. And that's, yeah, absolutely right. Again, with the rheumatoid arthritis, it's, guess it serves a few different benefits. It could help with the immune system, since rheumatoid arthritis is autoimmune, but then also could directly help with regeneration of the joints, which won't happen if someone just goes to like rheumatologist. So.
No, it won't happen. And I think this is particularly important now because we look at, this post-COVID world. I encourage your listeners to go and just go on PubMed, type in Karazian and COVID study. And have you checked out his study on COVID and its impact on autoimmunity? Are you familiar with that one, Eric?
I have not. I have done some research though, because I've had a lot of patients with thyroid autoimmunity that was apparently triggered by COVID, and there's a lot in the research, especially with Graves. I mean, there's some with Hashimoto's, but with Graves, there's a number of different studies showing a correlation. I know correlation doesn't always mean causation, but still, it seems pretty obvious that getting exposed to COVID led to their Graves' disease condition. But I have not
So
seen.
if you
I've
go
not
back
seen a
and
study.
in the fall, you got to read the study then. You got to check it out. And anybody who's listening needs to check this out because they'll understand a lot of what we see happening, because I've seen an explosion in autoimmunity in general since COVID hit. I started seeing it already in May of 2020. At that point, I interviewed another speaker for Laconia, Dr. Trevor Berry, who's in Arizona, and he's a neurological expert, and he was already seeing neuroautoimmunities popping up, the things that look like MS. And I interviewed him on my YouTube channel about that. And then by the fall of 2020, Karazian and Vajidani is a world-renowned immunologist. They were doing research on the spike protein's impacts on the immune system. And they released a preliminary study in the fall of 2020. And then in January 2021, in the journal Frontiers in Immunology, they released a study on COVID spike protein impacts on autoimmunity. And they were able to show that the spike protein can trigger autoimmune reactions versus, I believe it was 26 human proteins in the body. And they said this can be spike protein either from infection or from mRNA vaccination. And they weren't pro or anti-vax, they're just doing the data on here. They said if a patient with the right genetics is exposed to the spike protein, it can turn on autoimmunity against the thyroid, either Hashimoto's or Graves'. It can turn on neurological autoimmunity, gut autoimmunity. And we know once that gut barrier breaks down, that just opens the Pandora's box for all of the forms of autoimmunity. It can trigger a breakdown of the blood-brain barrier. could trigger rheumatoid types of autoimmunities, osteoporotic autoimmunities, diabetic ones, just a whole host of them. And so that's what we're seeing now. I'm seeing patients who didn't have any autoimmunity beforehand or said, oh, yeah, it was only my 90-year-old grandmother who had autoimmunity. Nobody who was a regular adult had it. Now I'm 35 and I've got it. Now my kid who's 12 looks like they've got autoimmunity already. And so this is important information for everybody to know. So it's great that you're talking about this stuff. It's making people aware of, they may feel completely different from then on after they had COVID or they had the mRNA vaccination, because they might have had autoimmune activation. So they've got to learn these steps of, what do you do with your nutrition? What do you do with your stress? And then what can we do with technology to assist that? So what I'm doing with a lot of these patients, because we'll have people coming in who already had, like, let's say Hashimoto's or Graves or something, and then they got COVID or they got the mRNA vaccination, and now they've gone haywire. They're like, oh my God, I can't control my heart rate, my blood pressure now. We're seeing these dysautonomias being really common. And then along with, the common things of loss of smell and taste, we'll actually use the lasers on these patients. Again, we'll hit the brainstem and we'll have them do, like, let's say if they lost smell and taste, we'll have them do smell stimulation, taste stimulation to try to regenerate those neurons. If they're having the issues with the heart rate and the blood pressure, we'll have them using the pulse ox and using the heart rate monitor while they're doing breathing exercises or vagus nerve exercises while under the laser. We know if it's attacking the gut, we'll hit a laser over the gut to try to stimulate the occludin and zonulin to be more balanced, to try to heal up the gut, and we'll try to do it over the brain as well too. So these are things that people are going to see this more and more, especially in the young kids, where the young kids were already being impacted just from their different diets compared to previous generations. COVID's really been a game changer in just ramping up all these autoimmune types of processes in the body.
Yeah, I agree, and I'll definitely need to check out Dr. K's study. And you said it was from released in the fall, this past fall.
No, 2020. That's how, he's always ahead of the
Oh,
curve.
20,
They were
wow.
already researching COVID in 2020, fall of 2020, the preliminary release, and then they did the release of the study in Frontiers in Immunology, January of 2021. So that shows you how far ahead. He's talking about COVID, like the spike protein in the vaccine, triggering autoimmunity. And in their conclusion, they even said they were concerned that a vaccine could potentially turn on autoimmunity. And what are we seeing now in the news 2 years later? Finally, they're saying, oh, looks like long COVID is autoimmune. Oh, yeah, we do see some patients who get the mRNA vaccinations who now have autoimmunity. And again, I'm not saying this is anti-vaccine or anything. It's just the reality is some people are going to have an impact from either the vaccine or from an infection that's going to generate long COVID. And it looks like it's autoimmune. And he and Vajadani were already saying that in 2020 when COVID had only been around for, less than a year.
Yeah, and there are other studies, not just with COVID, but yeah, you're right. There are studies also related. I don't know if I've seen with Hashimoto's in PubMed, but I know with Graves, there's some studies that show not only can COVID potentially be a trigger, but also the mRNA vaccine as well. And I haven't done
Yeah,
much
exactly.
research with other autoimmune conditions, but it wouldn't be surprising if the research is out there, yeah, for other ones as well.
Yeah. Yeah, because what he showed in there was that the spike protein shared, similarity in its protein structure with these 26 different proteins in the body. So you get that molecular mimicry. The immune system gets confused, and now it starts to look at, oh, hey, the thyroid looks like the spike protein, or hey, brain tissue looks like spike protein, or hey, cartilage looks like spike protein, or hey, the pancreas looks like spike protein. And so it starts to mistakenly attack it. And that's what they were able to show in that study, because they had tested it in the lab showing these reactions. So that again is where on these patients, when they come in like that, I use the laser because I'm trying to support the Treg cells. I'm trying to support interleukin 10. I'm trying to dampen the inflammatory cytokines. There's studies showing that the violet wavelength lasers has benefit even against an active COVID infection, or let's say if they have a smoldering lung infection, because they're showing that the COVID virus can set up shop and just kind of be smoldering in the brain, even in the ovaries, the testes, are showing it throughout the tissues. And so this helps to support the immune system against it. So again, this is where we can tie in all things together along with the person's diet and their supplementation and how they do their stress management.
All right. Well, awesome. Well, thank you for sharing all this. And where can people
Sure.
learn more about laser? Where can they find out about you, your practice, if they want to work with you directly?
Sure. Yeah, they can go to laserchiropractic.net, and that's laser with an S. They can do it if they Google me, they'll see I've been in so many podcasts and summits. They can hear all kinds of different lectures that I've done. I also have a Facebook group, Dr. Gair's Patient Health Performance Secrets, and so they're welcome to join that, even if they're not a patient of mine. That's where I talk about all things laser, nutrition, etc., things to try to enhance a person to have them be, better and have some hope in what they're doing. If they're looking for a practitioner near them, they can go to erchonia.com, and that's ERCHONIA.com, erchonia.com. They can click on the find a provider link and put in their zip code and find someone there, or they can message me. I have a group of over almost 1,000 doctors that I've trained, because I've been traveling the world, teaching other doctors. I do between 18 to 40 seminars a year, teaching other doctors both in the US and internationally, and in Latin America, and Spanish as well too. And they can message me, and I can see if I can put them in contact with someone because not all the doctors will know how to support autoimmune patients. They may have a laser, but they may not kind of be well versed in it. And you do want to be careful with that. Whatever laser you use, I want to make sure that the doctor has an idea of what they're doing. Ideally, that they've got some training in functional medicine, functional neurology as well too, so they can know kind of how to handle autoimmune patients better. Because we're not taught that in school. That's just going to say it. When we were in chiropractic school, we were not taught how to manage these kinds of things. At least in mine, we weren't.
Yeah, without question. Yeah, definitely. Yeah, I definitely wasn't taught in chiropractic school, and yeah, I don't know anybody else in chiropractic school who learned this. So yeah. Well, and of course I'll make sure to include
No,
all
our
these links.
education started when we graduated.
Exactly. Yep. You're right. But yeah, well, thanks. Thanks, Dr. Kirk. Appreciate your time. Again, I'll include these links in the show notes, and yeah, definitely visit Dr. Gair's website, again, laserchiropractic.net. And yeah, and again, thank you so much for taking the time to chat about lasers.
Well, thanks for having me on. I'm really happy to share this information, because again, this is my 20th year of using lasers. And remember when I got started, I thought I was late in the game, because the doc who trained me had been using them since the 80s, and I saw the Russians were using them since the 60s and 70s. I thought we are going to get at this point a lot sooner. So it's just now people are getting their awareness like it's a brand new thing, and it's kind of cool to see it. But I feel like the old dog and the old veteran in the laser world, because I've been fighting it out in the trenches for the last 20 years.
Yeah, well, thanks for everything you do, because again, you're the only. I mean, now there's other practitioners, chiropractors included, who are doing what you do because of you. So again, appreciate the time and research you've put into this.
Sure. Thank you. Thanks for that.